All right, so here we go. I'm Kalpesh Patel. I'm an Ortho-Bionomy practitioner, and I do a lot of work that utilizes a Taoist internal model that I have learned over the years from my martial arts practice. And I was asked to do a little blurb about the kind of work I do and how it might be relatable to applied channel theory. And I did some work today in clinic that I thought would actually exemplify this pretty well. So currently it has been extremely humid in north central Florida for I think about 2 or 3 weeks. Extreme heat, and then followed by a fair amount of heat and then a lot of humidity. And so there's just a lot of chest congestion that people have been experiencing. So I had several people come into clinic today that had this chest congestion at a level that was quite extreme. To palpation, it essentially felt like abdominal distension, but just in the thoracic area. So what I was eventually able to determine this in terms of the specifics was that the pressure was primarily in the pleura, but also on the medial aspects of the pleura, so affecting the mediastinum and the pericardium, basically. And so the technique that I used to try to essentially decompress or disperse the force in these tissues was to actually connect to the lung channel and the pericardium channel at the hand, and sometimes the wrist, depending on where I felt like I got good contact. And that's where the Ortho-Bionomy palpation skills kind of come into play, and also kind of reveal something of the particulars of the channel as its components are fascial tissue. And the specifics of that is that it's not enough for me to just touch the thumb. I've actually got to connect to the fascial layers of the thumb, working my way in from the skin or out from the joint until I feel like I get a response actually in the chest. And on this day particularly, I had to sort of partition out the work. So I had to actually have a different contact if I wanted the posterior pleura, a different contact if I wanted anterior inferior pleura, and a very different contact along the channel if I wanted the pleura on the medial aspect of the mediastinum. And so the first thing is just finding a contact point on the channel that I register some sort of response. And then the next thing is to actually look for the capacity to rotate the channel tissue so that I'm rotating it into external rotation away from midline, essentially to create more space in the channel for a bolus of pressure to work its way out. So unlike just connecting to the channel to stimulate a neurological response along it that would be essentially electrical, I'm actually looking for physical pressure to be able to move through. And so if you think of the channel as essentially a tube in the tissue, I need to actually play with the tissue to see where I can get the tube to actually open up enough, but still have enough flex in it that a bolus can work its way through, kind of like peristalsis. With this kind of pressure that I was dealing with, it took about 10 minutes per hold for a substantial amount of the pressure to work its way out. But it was obvious that the pressure worked its way out because people would then start to actually breathe into that area, and ultimately up after treatment and they were weight bearing, they would report actually physically feeling lighter and feeling like they had more space in their chest. Yeah, so that's basically it. I hope that's helpful, and I'm sure I'll be asked to clarify and answer questions at some point in the future.